and we want to welcome everybody to tonight's session. We're uh, we're going to be doing a topic which um, is really so important because it has to do with our kids and families. Um, and the more kids and families we can get who understand the science behind healthy eating and healthy lifestyle choices, the healthier our population will become. Um, so we're fortunate to have Dr. Eric Colgrove, pediatrician, who's a Eugene plant-based provider with us. We'll let him tell you his story in a moment, but before we start the session, we like to kind of see if a few more people may log on over the next 3 or 4 minutes. So in the interim, we usually ask, is there anybody new? And would you care to share how you found out about the classes? And if no one else raises their hand, then ultimately Arian, uh, he's looks like he's likely going to volunteer a little information about what's been going on in his life. Met him at a health fair, I don't know, a week and a half, almost 2 weeks ago, or whatever. So is there anybody besides Arian who is new to the classes tonight? Or would care to share anything first? You get first choice. I'm going to take a look at the view of the gallery so I can see everybody who's on here. And it looks like most everybody's been here. So in that case, why don't we go ahead, Arian, and welcome. I know you were
Thank
here
you.
last
Thank you
week
for
and
having me.
look forward to hearing what you have to say about all this.
Yeah, can everybody hear me okay?
Yes.
Okay, perfect. Yeah, my name is Aryan. Uh uh like Dr. Ross said, we met at a community health fair called Dia de Salud in Eugene, where we provided some free healthcare information to those who may not have direct access to a physician. And I've always had a fascination with nutrition and uh, specifically optimizing nutrition for muscle growth, actually. But through conversations with Dr. Ross, I have kind of shifted my focus not towards optimizing muscle growth per se, but towards optimizing life, I guess you could call it. And after our conversation, it really resonated with me how passionate Dr. Ross was about the his area of study and whole foods, plant based. While I don't personally practice a whole food plant based diet, I have incorporated a lot of those ideas into my my own practices over the past few weeks, and I have to say that the the benefits are many in number. I just to list a few, I I have very consistent energy throughout the day, which is unlike most diets I have tried to follow in the past. Uh, my fiber intake is nearing nearly 70 grams a day now, and I feel as though my digestion has never been better. And what else? I think quite clearly. I don't really notice very many lapses in my cognitive ability, I guess you could say. And overall, I've just found that integrating the ideas of whole food, plant-based nutrition into my lifestyle, where they may be beneficial, have been awesome. And now I'm here for the second week, and I really look forward to perhaps I'd be able to shadow Dr. Ross eventually and learn more about what it is to be a physician. I really want to go to medical school and hopefully have the same passion and happiness that Dr. Ross has seemed to achieve in his practice. And yeah, that's why I'm here. I'm gonna stop now because I kind of been rambling a little bit. But thank you for having me, everybody. I see a few people who I saw last week, and yeah, I'm looking forward to today's lesson. Thank you.
Well, welcome, Arian.
We liked what you said, and I didn't think you were rambling at all.
Oh,
Good to meet you.
thank you so much. Good to meet everybody.
Anybody else have anything they care to share before Dr. Colgrove gets started? Okay, well, I don't see anything in the chat. I'm going to go to the gallery real quickly and see if there's anybody else. Okay, I guess we have plenty of time. Can go ahead and get started and learn some stuff and have a little fun at it. Time to fire away, Dr. Colgrove.
Okay, I am trying to. Now my unmute issue is not coming up.
You're present twice. You're muted on one and you're not muted on the other, but you're coming up twice. You're on two videos.
Ooh.
There you go.
Huh.
It sounds like you have a speaker going on one of them. So if you mute one and then you have
Yeah,
a
I know, I
on
got
the
it.
other.
I got it. I'm trying to find where my other video is. Oh, it's there. Okay. Oh,
That's my techno savvy daughter.
That's great.
let's see. Can you hear me?
Yes, we can hear you.
No, but it's still. Yeah. Hold on. I'm still working on my thing, so let me get it.
Well, in the interim,
Yeah.
I guess we still have that feedback. So,
Okay, you want to try to mute one of mine?
yeah, I'm
I
going to
can't.
I'm going to mute everyone,
I'm going.
and then we're going to. You can unmute now, one of yours, whichever you want.
Okay. There. Can you hear me?
Yeah, we can hear you, and there's no feedback now.
All right. Well, good. Yeah, it's complicated because I've got my microphone going through my phone, my video going through a different camera, and I've got the sound coming through on a different thing. So it's because my machines aren't working quite right. So believe it or not, go figure, I got technical issues again. That's the story of my life on Zoom for Live Lifestyle Muslim anyways. All right. Yeah, so let's go ahead and start. All right. Yeah. Well, I'm just so excited to be here. I've been a pediatrician for 27 years and really it's just been a great job. What a career it's been for the past 27 years. Some of the reasons I went into pediatrics is that it really lets out my inner child. I'm able to sort of act my goofball self and really connect with my patients that I have. So that's one of the reasons I chose pediatrics. The other is I just really like witnessing the development from a relative blank slate of a child to a thriving adult. So that's another one. And also, I really want to avoid treating patients who who kind of thrash their bodies for decades and have been suffering for all the time and are on a myriad of different medicines and all due to poor lifestyle changes. And so really pediatrics allows me to be in this sort of preventative mode, and that's really what gets me jazzed, is trying to figure out how to help people find the right place they should be so that they could live a long, healthy, happy life. um and yeah, it just makes me think about the future and how just imagine a world where aging isn't tied to disease automatically like it is now. Now we all think about, when we think about older folks, we think about how they're all suffering from diseases. A lot of them have a number of diseases and are on medicines, and it really shouldn't necessarily be that way. At least it's not going to be way in the future, and hopefully it's sooner than later. So that's good. Um, and I want to just mention that if anybody has any questions or comments, please go ahead and you can ask them at any time. You don't have to wait for me to stop or anything. So if you could, Charlie and Scott, if you could look out for people that are raising their hands, that would be helpful, because
We will do that.
Okay, thank you. Yeah, I don't have the ability to really watch everybody. All right, so just wanted to mention how it became whole food plant-based, and really my journey started in medical school when I had no clue that I was going to get zero nutritional education. And so what I did was I was in medical school, and I would go to the deans of the medical school and complain that, hey, how am I going to know less about nutrition than my patients actually will? Because I thought that, gee, nutrition is like an important part of health, and I guess the administration didn't feel the same way. So I was like, well, I'll just educate myself. Then I'll have to do that. And of course, after medical school, I went right into internship and residency, which is extremely busy, and didn't have time to do that. And then by the time I got into my career, I don't know, forgot or developed excuses not to teach myself that. I don't know what it was, but I went by another 20 years. I went to medical school, 30 years ago almost. So it wasn't until I worked at a clinic in town that there were a couple physicians that were a couple providers that were teaching a class called Food as Medicine. And that I thought, well, gee, this is, I've ignored this for this many years. I need to really start learning this kind of stuff. So I had the opportunity, and thank goodness I went to that class for Food as Medicine, which was taught by Charlie and Scott. And it immediately it started clicking with me, just about, oh my gosh, this is exactly what I need, which is to learn how to really give your body what it needs, because the human body really is resilient. And that was that was evident to me, and it's something that if you give it what it needs, especially from early on, and you continue that process, you're going to have a really healthy person, and they're going to avoid all the diseases. So to me, it just all kind of clicked in place, and it really changed my life, professionally for sure, but also even personally. I felt different, and it just made so much sense to me that it was really satisfying, professionally and personally. So, but I'm gonna show this video. Let me see if I can share it. Hey Charlie, can you show that first video? I'm afraid with all my different things going on, I'm just gonna mess it up.
Yeah, I'll go ahead and do that.
Okay. It's that first
I'm
video.
gonna put the share on here
Yeah.
and optimize it, share it. And I'm going to, I need to minimize this. I need to find the kids. Here's the kids folder. And it's going to be lifestyle medicine, treating
Yeah.
the
Yeah.
causes.
Treating the causes. Yeah.
Okay. Everybody see this?
Though I was trained as a general practitioner, my chosen specialty is lifestyle medicine. Yes, most of the reasons people go to see their doctors is for diseases that could have been prevented, but lifestyle medicine is not just about preventing chronic diseases, but also about treating them. And not just treating the disease, it's treating the causes of disease. If people just did 4 simple things: not smoking, exercising half-hour a day, eating a diet that emphasizes whole plant foods, and not becoming obese, that may prevent most cases of diabetes and heart attacks, half of strokes, and a third of cancers. Even modest changes may be more effective in reducing cardiovascular disease, high blood pressure, heart failure, stroke, cancer, diabetes, and all-cause mortality than almost any other medical intervention. The key differences between conventional medicine and lifestyle medicine is instead of just treating risk factors, we treat the underlying causes of disease, as described in this landmark editorial. See, typically doctors treat risk factors for disease, such as giving a lifetime's worth of medications to lower high blood pressure, elevated blood sugar, high cholesterol, but think about it. I mean, high blood pressure is just a symptom of diseased dysfunctional arteries. Yes, you can artificially lower blood pressure with drugs, but that's not treating the underlying cause, which often comes down to things like diet and exercise, the penicillin of lifestyle medicine. And disregarding the underlying cause and treating only risk factors is somewhat like mopping up the floor around an overflowing sink instead of just turning off the faucet, which is why medications usually have to be taken for a lifetime. If a floor is flooded as a result of a dripping tap, it is of little use to mop up around the floor unless the tap is turned off. The water from the tap represents the cost of disease, the flooded floor, the diseases filling up our hospital beds. Yet medical students learn far more about methods of floor mopping than about turning off taps, and doctors who are specialists in mops and brushes can earn infinitely more money than those dedicated to shutting off taps. And the drug companies are more than happy to sell rolls of paper towel, so patients can buy a new roll every day for the rest of their lives. Paraphrasing Ogden Nash, modern medicine is making great progress, but just headed in the wrong direction. Preventive medicine is, frankly, bad for business. When the underlying lifestyle causes are addressed, patients often are able to stop taking medication or avoid surgery. We spend billions cracking people's chests open, but only rarely does it actually prolong anyone's life. In contrast, how about wiping out at least 90% of heart disease? Think about it. Heart disease accounts for more premature deaths than any other illness and is almost completely preventable simply by changing diet and lifestyle. And those same changes can prevent or reverse many other chronic diseases as well, the same dietary changes. So why don't more doctors do it? Well, one reason is doctors don't get paid to do it. Right? For no one profits from lifestyle medicine, so it's not part of medical education or practice. Presently, physicians lack training and financial incentives, so they continue to do what they know how to do, prescribe medication and perform surgery. After Dean Ornish proved you could reverse our #1 cause of death, heart disease, open up arteries without drugs, without surgery, just with a plant-based diet and other healthy lifestyle changes. He thought that his studies would have a meaningful effect on the practice of mainstream cardiology. After all, a cure for our #1 killer? But he admits he was mistaken. Physician reimbursement, he realized, is a much more powerful determinant of medical practice than research. Reimbursement more than research. Salary over science. Wealth versus health. Not a very flattering portrayal of the healing profession, but hey, if doctors won't do it without getting paid, let's get them paid. So, Dr. Ornish went to Washington, arguing that, look, if we train and pay for doctors to learn how to help patients address the real causes of disease with lifestyle medicine, not just treat disease risk factors, we could save trillions, and that's just talking heart disease, diabetes, prostate, and breast cancer. The Take Back Your Health Act was introduced in the U.S. Senate to induce doctors to learn and practice lifestyle medicine, not only because it works better, but here's the critical factor: physicians will be paid to do it. The bill died, just like the millions of Americans will continue to do with reversible chronic diseases.
Okay, I'm going to stop the share for now.
Okay. All right. Yeah, so I wish I had seen that video like in medical school. If you could imagine what that do for all the physicians in the country who are training, if they were able to see something like that. That's exactly what we need to see, is learning about how you can actually get to the root causes of disease and not just be mopping up the floor all the time. So back to children, the first priority when thinking about child nutrition is to optimize children's growth and their development and well-being. And to do that, we're focusing on a few different things. One is just making sure they get adequate calories. You want to get sufficient nutrients to them. And establishing habits and behaviors so kids choose healthy foods, because it's all nice and good to put a plate in front of a child, but if they're not going to eat it, that you can't force it to them. So you have to get the right habits and behaviors. And then you have to raise children with connection and love. And so those are the things that we think about in getting all this nutrition and well-being to them. Those last three topics, the sufficient nutrients, the establishing the right habits, and raising children with love and connection, they're topics in and of themselves, huge topics. And so something we can think about at another time. But there are a lot of nutrients, really very similar nutrients. There's not really a big difference between the nutrients that are needed in an adult versus needed in a child. There are some in infants. There are definitely some differences in how much, for instance, like fat content they need. That there's the macronutrients certainly are different. The micronutrients are pretty much the same. We all need these different things, and plant-based kids certainly need to be on a supplement of B12. We've talked about B12 in this class already, and that's important for them as well. So this is all nice and good, but what if you, as a patient with a pediatrician, what if you're in a pediatrician's office and they don't agree with you, and they don't think that your ideas of a plant-based nutrition is healthy, that you're going to be missing way too much? So what do you do at that point? I think what's important is communicating with them openly and understanding that they don't have to agree, but you can actually take out the advice from the major academies. The Academy of Pediatrics and the Academy of Nutrition both support well-planned vegan diets at all ages. So, and in pregnancy, and infancy, and all throughout. So there's not like certain ages that you just can't you can't be plant-based. It's really all ages, including pregnancy. So, you know, sometimes they'll talk about how can you not eat meat and milk, and it's got to be consumed. That you have to get something from meat. It's just the way it's done. It's done that. We've done that forever, right? Well, meat and milk is kind of code for protein and calcium. And those protein can certainly be had from a healthier source, and so can calcium. Calcium does not have to be from milk at all. I mean, cows don't naturally just produce. Well, they do. I'm sorry, they do produce calcium in their milk, just like any other mammal. But it's not something that drinking another species milk is going to get us the healthiest form of calcium. Cows do get calcium from somewhere, and that's from the plants around them, and that those plants got it from the soil around it. So we eat plants, not soil, and we shouldn't be eating cows. So anyways, yeah, it's something that I have to talk to parents a lot. The idea that, well, gee, I grew up drinking milk, and then from what I understand, that you've got to drink milk as soon as you're 1 year of age. Well, that's what most pediatricians will tell you, that you've got to drink cow's milk from age 1 and up, and it's just not true. We've been sort of brainwashed. Both the physicians and the patients have been brainwashed that we need to have breast milk from a cow, and it's just so not true. When you think that 2/3 of the world can't even digest lactose after age 4, and the fact that cow milk protein causes so much disease. It's just not good for us. It increases the risk for cancer. It causes all kinds of things with bowel problems. In fact, you can't even feed an infant who's less than 1 year of age cow milk, because it can cause a horrible, deadly hemorrhage in their gut, because it can be so toxic to their gut. But yet we feed kids as soon as they're 1. Oh, they got to jump on from breast milk to breast milk of a cow. It doesn't make any sense. So I've been slowly educating my patients, and they seem to be receptive to it. It wasn't that way. It wasn't that way maybe even 5 years ago, but before that, it was. People resisted it much more, and I think we see less resistance to it because there's so many alternatives to milk. I think people are starting to get the fact that we're not cows, and really we should be leaving the breast milk of the cow to calves. So, and I want to stop here and see if anybody has any questions. Yeah, is there any thoughts or concerns or questions about cow milk maybe, and how could you not give it to your children?
Yeah, Sarah,
Yeah.
unmute yourself.
Hi. So there was just a kind of a thought that I had that I really agree with the plant-based diet. And I'm just wondering, initially then, when there weren't manufactured B12 vitamins, then what would we do?
Well, what we did was we ate the vegetables, the plants around us, and we didn't wash them like crazy like we do now. So we basically would get it from the dirt, and from the plants and the dirt. So yeah, we would get a store of calcium when we were breastfed, and we typically were breastfed longer. We're talking about 10,000 years ago, and cows weren't domesticated till 10,000 years ago, so nobody was eating this stuff. was taking breast milk, and until a few thousand years ago, and that's not enough time to change our genetics profoundly. So we really aren't made to drink that cow milk. And yeah, so anyways, if you think about like a carrot or something, you pull a carrot out of the ground, it's going to have dirt on it, and you're going to eat the dirt that's on there. And so you're going to get
that's what B12 is dirt, basically.
B12 comes from the B12 comes from the microbes that are in the dirt. So
Okay.
yeah. So no, it's not the dirt itself, it's the microbes in the dirt. Yeah.
Okay, thank you.
Yeah. Any other questions? All right. Well, actually, why don't we play the next one, Charlie, the treating reflux in babies with diet.
Okay. We're going to share here, and I need to just get on to share here. Treating reflux. Here we go.
There's been a long-standing problem among zookeepers of the gorilla, a Latin name gorilla, gorilla, gorilla. The problem is that they were throwing up all the time. We've never seen wild gorillas barfing, but it had unfortunately been accepted as routine by many zoos. What were they feeding them? Well, they're big, strong animals, so they made sure to feed them lots of protein, cottage cheese, meat, eggs, milk, until a zoo in Germany got this radical idea to try giving them their natural diet, and the change following the alterations to the diet was astonishing. I mean, before, the poor silverback was regurgitating and vomiting during most of the day, but by the third day eating what they were supposed to eat, he and the rest were all miraculously cured. Even just removing milk from captive gorilla diets led to significant improvements. Cow's milk was historically considered an essential item in the captive gorilla diet, but they showed that removal of milk from the captive gorilla diet may reduce such undesirable behaviors and may be a step towards better approximating their natural diet. I mean, giving an animal milk after weaning? Giving an adult animal milk? Milk is for babies. And then giving milk from a bovine to a primate? What were these crazy zookeepers thinking? Doesn't make any sense. Reminds me of this landmark study. 81 children presenting with reflux, gastroesophageal reflux disease. So they were given drugs, and 2/3 got better, but 27 kids still did not. So they tried eliminating cow's milk from their diets, and within 1 month, all 27 were cured. Symptoms of acid regurgitation, heartburn, or both, occur at least once a week in 10 to 20% of adults in the Western world, and about up to 25% of all infants. Now, it's normal for babies to spit up occasionally. That's not what we're talking about. It can actually get quite serious. Up to a quarter of infants present with regurgitation severe enough for parents to seek medical help. And it may just be that they're sensitive to cow's milk. The symptoms of cow's milk protein allergy overlap and may coexist or complicate GERD reflux. Even if there's no formal dairy allergy per se, there appears to be some kind of cow's milk hypersensitivity among many infants and children with severe reflux. There's all sorts of invasive tests you can do, like stick pH probes down the poor baby's throat, but probably the most practical test in routine pediatric practice is just a trial of a cow's milk protein elimination diet for 2 to 4 weeks in infants with reflux. The gold standard is what's called an elimination and re-challenge protocol, where you see full resolution of symptoms via strict elimination, followed by recurrence of the symptoms on reintroduction of cow's milk protein. And when you do that, And take 200 or so infants diagnosed with reflux and then not only put them on a cow's milk-free diet, but then do the challenge test. 85 of the 204 infants with reflux were actually suffering from a cow's milk allergy, or at least hypersensitivity or something. What we think is happening is that our immune system attacks the bovine proteins as understandably foreign, triggering an inflammatory response, which irritates the nerves lining your digestive tract, and that results in abnormalities in the rhythmic contractions of the stomach, triggering the regurgitation. We're not just talking about formula-fed infants. Cow's milk protein allergy can occur in exclusively breastfed infants, as intact cow's milk proteins can be secreted in breast milk. If the mom drinks milk or eats eggs, it can get into her baby. Cow's milk protein and other foreign proteins can pass into human breast milk. So breastfed infants with regurgitation and vomiting may therefore benefit from a trial of withdrawal of cow's milk and eggs from the maternal diet. And indeed, that is now the consensus recommendation of both the North American and European Society for Pediatric Gastroenterology, Hepatology, and Nutrition. Anytime you see reflux, let's first try a therapeutic trial of either cow's milk protein-free formula or, for infants who are breastfed, a maternal strict cow's milk protein elimination diet. And so then we can potentially treat the cause without using unnecessary medications, and certainly before you start considering performing any anti-reflux surgery on the poor kid.
So that would be a good video to show a pediatrician if they're really concerned about not having milk, is to show them that kind of video. And when you're addressing the pediatrician or the provider, you want to do it respectfully and be careful. The providers, as providers, we really typically are pretty have sensitive egos, so you want to be careful about being too harsh and critical, but basically gently bring it up. And if they're dismissive, then I suggest you find a new one. If they're really just not willing to work with you, I think it is important to be open about it and communicate with it. But if they can't really do that and they seem too hot-headed about it or strong-willed about it and not willing to work with you, then it's probably time to move on. But also, when you're looking for pediatricians and interviewing pediatricians, one thing you can do is actually, that's one of the questions you can ask. Well, what are your theories about nutrition and health? Is really actually a very important question. You could ask a prospective pediatrician for the most important person coming in your family, which is your baby. If you're pregnant, you're kind of looking around for a pediatrician, right? So, and you can interview pediatricians for free. It's not like you've got to pay a fee or doctors. No, there's nothing. It basically just it's called a meet and greet. You can interview a number of different pediatricians and just find out who jives with your thinking the best. So I think it's important. But I've got another video that we could share with the pediatrician too. So one of you pull up, Charlie, the next one, which is how to prevent diabetes in children.
Okay. That is coming up right now.
Okay.
Oh, there's a question.
Oh yeah. What we got?
Let's see. I'm going to stop this and we're going to see what the question is. I think I can stop this.
Prediabetes is not...
I can stop it like this, so I'm going to stop the sharing. So who has a question? Let's see. There was a question about Dean Ornish's video. We may get a chance to play that, and I think it'll answer your question in a bit. Anybody else have a question right now? No? All right, then maybe it was just an unmuted microphone, which is not uncommon. It's not a crime. It just makes us kind of spin our wheels a little bit and go back and play this video. Here we go.
Prediabetes is not just a high-risk state for the development of diabetes. Prediabetes can be a disease in itself. People with prediabetes may already have damage to their eyes, kidneys, blood vessels, and heart. Evidence from numerous studies suggests that the chronic complications of type 2 diabetes start to develop during the pre-diabetic state. So by the time we have prediabetes, it may already be too late to prevent organ damage, so best to prevent prediabetes in the first place. And the earlier, the better. 30 years ago, virtually all diabetes in young individuals was thought to be autoimmune type 1 diabetes. But since the mid-90s, we started seeing an increase in type 2 diabetes among our youth, particularly in the United States. Indeed, the term adult-onset diabetes has now been scrapped and replaced with type 2 because children as young as 8 are now developing the disease, and the effects can be devastating. A 15-year follow-up of children diagnosed with type 2 diabetes found an alarming rate in young adults of blindness, amputation, kidney failure, and death in young adulthood. Why the dramatic rise in childhood diabetes? Because of the dramatic rise in childhood obesity. During the past 30 years, the number of children diagnosed as being overweight has increased more than 100%. Once an obese child reaches 6, they're likely to stay that way. And even if they don't, being overweight in our youth predicts adult disease and death regardless of adult body weight, even if we lose it. Being an overweight teen may predict disease risk 55 years later, twice the risk of dying from a heart attack, more cancer, gout, arthritis. In fact, being overweight as a teen was a more powerful predictor of these risks than being overweight in adulthood. This underscores the importance of focusing on preventing childhood obesity. So how do we do it? From the official American Academy of Pediatrics clinical practice guidelines, the problem appears to be kids eating too much fat and added sugars and not eating enough fruits and vegetables. Doctors at every occasion, beginning soon after a child's birth, should endeavor to give sound advice regarding nutrition and growth so that obesity and its complications may be curtailed. What might sound advice sound like? Well, the chair of the nutrition department at Loma Linda University published a paper suggesting not eating meat at all might be an effective strategy. Population studies have consistently shown that vegetarians are thinner than comparable non-vegetarians. This is from the largest such study to date. A body mass index of over 30 is considered obese, 25 to 30 overweight, and under 25 ideal weight. The non-vegetarians were up at 28.8. The average meat eater in the U.S. is significantly overweight. As one gets more and more plant-based, the average BMI drops. But even the average vegetarian in the U.S. is overweight. The only dietary group that was on average ideal weight were those eating strictly plant-based. So that comes out to be about a 33-pound difference between the vegans and the meat eaters. Vegetarian children grow up not only thinner, but taller. Vegetarian kids grow to be about an inch taller than other kids. Apparently, meat intake is somehow negatively associated with height. I can just hear the Dairy Council now saying, oh, it's because of all the milk the veggie kids must be drinking. No. The veg kids consume significantly less dairy and much lower animal protein intake overall. Meat intake is apparently associated with growing wider, though. In school-aged children, the consumption of animal foods, meat, dairy, or eggs, is associated with an increased risk of overweight, whereas plant-based equivalents like veggie burgers, veggie dogs, veggie cold cuts were not, and whole plant foods like grains, beans, and nuts were found to be protective. This may be because plant-based diets are low in energy density, high in starch, fiber, and water, which may increase feelings of fullness, and resting energy expenditure, meaning resting metabolic rate. Eating plant-based appears to boost metabolism, so we just kind of burn more calories at rest, even when you're sleeping. However, we're not sure how much of the benefits are due to increased consumption of plant foods versus the decreased consumption of meat. Either way, plant-based diets should be encouraged and promoted for optimal health. Local, national, international food policies are warranted to support social marketing messages and to reduce the social, cultural, economic, and political forces that make it difficult to promote such diets. For example, although the advice to consume a plant-based diet is sound, questions arise regarding the relative high price of produce. Yes, we can reduce the burden of childhood obesity, prevent the further spread of disease, but we need to ensure that plant foods are affordable and accessible to children of all income levels. Fruits and vegetables may not fit on the dollar menu, but our kids are worth it. Getting diabetes in childhood cuts nearly 20 years off their life. Who among us wouldn't go to the ends of the earth to enable our kids to live 20 years longer?
That was a pretty amazing statistic at the end there.
Yeah, that's a tough one. And the whole idea about diabetes starting at younger and younger ages is real. I was working on the Navajo reservation in 1998, and we were seeing the waves of obesity before the rest of the nation really was. They kind of lead in that department, diabetes and obesity. And really, adult obesity, by the time someone was 40 years old, half of the Navajos had type 2 diabetes. And in residency, I spent all this time really learning about type 1 diabetes, and it's a totally different disease. It's completely different, and it's treated completely differently. There's a lot of those kids can be very sick, the type 1s, and it's just a different treatment. And it's so I thought my first job out of residency would be working with kids that had type 1 diabetes, but I never saw type 1 diabetes on Navajo reservation. It was only type 2 diabetes, and so I had to make a big switch in my mind. And the youngest child that I saw was 8 years old with diabetes. Just like you said, we were probably earliest in the nation for childhood type 2 diabetes. So yeah, we think of diabetes as an adult disease, but it certainly starts in childhood. And the next thing I wanted to talk about was really other diseases that begin in childhood. The classic one really is heart disease. And we started learning about this way back in the 50s during the Korean War, when autopsies of the young soldiers were done. A certain number of autopsies were done, and it was discovered that these 20-year-olds had early stage heart disease. They'd see streaking in their aorta of fatty cholesterol plaques, and that's really how heart disease starts. Of course, you get that fatty cholesterol streaking and damage in all the arteries of the entire body, and ultimately it's how it gets into the heart vessels, and that's what causes the heart attack. So what you just happen to see it in the aortas because it's the biggest vessel, and the one that you open up when you do an autopsy. You can easily look in that. They typically don't open up all the smaller arteries, but that was what was first seen. And then so there were studies done on younger people. There was a large one that was done in the US of 10-year-olds, and found that the majority of 10-year-olds even had the same kind of cholesterol streaking in their aortas. Not everyone, but a good majority of them. Well, fast forward a couple decades, and then you have better technology good enough to look at fetuses. So in the womb, you do the prenatal ultrasounds, and they were able to find that even there were certain babies that would have this cholesterol plaque building up in their aortas already. And studies were able to tie the mother's cholesterol level to the babies that actually had the cholesterol streaking. And so that is quite impressive when you think about it, that our number one killer in the United States starts, not just a younger adult age, not in childhood, but before you're even born, just based on what mother is eating. It's just astounding. So that's how serious this disease is. And how do we prevent that? Do you guys know how we prevent that that fatty streaking buildup, that early heart disease from even starting? Do you guys know? Who knows? Yeah. The obvious answer is a whole food plant-based diet. The other more specific answer would be to decrease saturated fat in your diet. Cholesterol too, but the saturated fat is really the big thing in your diet that leads to that cholesterol streaking. But other diseases that start in childhood that we think of traditionally as adult diseases, but it's really start in childhood, are going to be dementia, stroke, arthritis, autoimmune diseases, some cancers. So all these things really have their starts in childhood. So if we do a really good job at preventing these risk factors, then actually they will be disease free. One of the cancers that's not diet related so much, it maybe has some diet aspect to it, but is skin cancer, things like melanoma. Well, that most of that risk happens in your first 15 years of life. You get that throughout your life. The risk of soaking up the UV damage from the sun, but the most harmful and risky stuff is when you in the first 15-20 years of life. So that it's not all just nutrition behaviors. There's a number of different behaviors that lead to adult diseases that start in kids. And next I want to talk, well, any other questions about that? See if there's anything else out there. Any other thoughts?
I want to jump in for a minute. Beth, I know you're on the East Coast and I don't want you to turn into a pumpkin. You made the comment about how Dean Ornish's program has been approved by Medicare. And yes, it's been approved for cardiac rehabilitation in the adult population. I don't know whether it's actually approved. I don't think it's approved for preventive health care. So it took 30 years for him to get that program approval, but it's mainly for someone who's already had a heart attack or stroke, and then they enter the program. Hopefully people will enter a whole food, plant-based lifestyle before they have their heart attack or stroke.
Thank you.
You're welcome.
Yeah, sounds right. Yeah. Okay, any other thoughts or questions or comments, concerns?
I
Hey,
I have a
Yeah.
question.
Alice,
Yeah, can you comment on like nicotinamide, the benefits of nicotinamide with melanoma? Like how beneficial is it? I mean, there's some studies that say it helps. Is it, the
yeah. Do you guys know?
I don't.
Yeah,
Gregor has some articles on nicotinamide, I think. I
yeah.
guess I would do a search on his site and see what he has to say. Um, I haven't seen anything specific to that reversing,
Scott's looking up.
fixing, or preventing.
Hey, Scott, what do you got?
No, nothing. Yeah, I remember him reading about that in one of his books, but I'd have to do a search and look it up, so I don't remember anything
Yeah, I
specific.
know. All right. All right. Well, I have been practicing this amount of time, 27 years, and realizing that one of the things that really seems like it's leading to unhealthy uh, eating and diseases is picky eating. You wouldn't think about it, but recently I've been thinking more about it, how many picky eaters I have, and they seem to have at least one parent that is a picky eater. They don't do family meals as much, or they just uh, typically it's the father for some reason, but the father doesn't touch green food, vegetables basically. So, I think picky eating for me is one of the things that I really want to talk about, because it's such an important subject that kids shouldn't be picky eating, but picky eaters. They really should. What you want to do is right from the get-go is make eating a part of family. It should be a family bonding experience that everyone eats together. It should be a pleasant experience, and there shouldn't be this forced, like, oh, you've got to eat your veggies kind of thing. It should be just a natural part of eating. The first 6 months is breast milk. And then after that, what I like to do is what's called baby-led weaning, where babies actually are able to feed themselves soft foods, non-chokeable things. Obviously, you don't want to give them a hard carrot or nut or something, but you can give them carrots. If you just steam it or cook it real good, make it soft, and make it kind of finger shaped. They can grab onto it, and they can actually bite it, chew through it without teeth. You don't need teeth to eat it at these young ages. Their gums are quite sharp and effective at gumming stuff down. But basically, my favorite first foods are things like avocado and banana, things like sweet potatoes. There's all kinds, there's all kinds of good stuff. And really at 6 months, it's also good to expose kids to nut products, because that decreases nut allergies. So obviously they can't eat the nuts, but you can smash up a nut and sprinkle it on their food, and that's good enough. Or you can just take a little peanut butter and thin it out with some water, and put it in their food. If you're doing pureed foods, that works pretty well too. I do like the idea of doing infant cereals, because it has a good, healthy amount of iron. I know babies are not eating a lot of iron sources at this age, and they do get low in iron. Where do they get the iron from? Well, they steal it from mother, and so they kind of load up on it right before birth, and then that iron store lasts for 4 to 6 months. But in that 4 to 6 month period, it starts going down. I like the idea of even starting a little bit earlier than 6 months by doing some iron fortified cereal, like oatmeal cereal, and the infant kind, and mixing it with some breast milk, and then so they have a familiar taste to it, and feeding that to babies, once a day. I think it's a good idea to keep those iron stores up because the brain is really needs those extra iron. And there's studies that show that if you become anemic in the first couple of years of life, you actually can lose some IQ points. You actually, it's a big deal. It's not like adulthood anemia where you get fatigued and that kind of stuff. You actually can lose some development. So very important. But basically, when you're doing the plant-based, the baby-led weaning, they're eating regular foods. Once they get past a year, you can kind of bridge them into eating more of what the family eats. Really, there's no restriction. You just got to be careful of any chokeable things. But after a year, they're eating everything that a family would eat, just not the chokeable things. So I like the idea of sitting all the children around the table and really having all the electronics off and focusing on just eating together. And there's not like a big deal of who's eating what or how much I think what I might want to do is play that AAP video about picky eaters, because it has some good suggestions in there too.
Okay, so let's see, we're getting close to it. And we will do the picky eater.
Eating healthy foods is important for your children's growth and development, but it can be downright frustrating to get kids to eat a variety of foods. Here are some tips to help you handle picky eating. How can I help my picky eater explore new foods? Encouraging your toddler's sense of independence is a great way to make him more likely to try new foods. You can let him choose a healthy new food at the grocery store. Have him help prepare food in the kitchen. Let him feed himself and give him choices. Offer a healthy option you know he likes and another that's a new taste. Giving your toddler choices about what and how much he eats will make him feel like an independent little person. Things could get messy, but he'll be proud and excited to try something he helped choose or make.
He copies everything I do, so I make sure he sees me eat my veggies.
If she's not into a food, we just keep trying because she goes through phases with stuff. She's like, no, yes.
We keep an eye on how much milk she drinks during the day. If she's had too much, she won't be hungry at mealtime.
What if my child refuses to eat? It's normal for kids to get upset sometimes during meals. If it feels frustrating, you're not alone. So many parents have been there. Here are some approaches you can try. If your child gets upset about food, try to stay calm. The best reaction is no reaction at all. Don't feel pressured to make a second meal. Tell her that this is the meal you've made for the family and she can eat it or not. Trust that if your child is truly hungry, she'll eat. If not, she can wait until the next meal, and that's okay. It's hard to stay firm and be patient, but it's worth it. By being consistent, you'll help your child become a healthy eater.
We try not to push her bargain. He gets more stubborn under pressure.
Her appetite varies from day to day, and she seems to know how much food she needs. So I try not to worry if she eats a little less or skips a meal.
Our pediatrician says it's my job as a parent to offer healthy meals and snacks, and it's my child's job to decide when and how much to eat.
It can take time and effort to get your children eating a variety of healthy foods, but your patience and calm through all the funny faces, messes, and tantrums will set them up for a lifetime of healthy eating. For more information about healthy habits for your children, visit www.healthychildren.org/growinghealthy.
good information from that video. So I like the American Academy of Pediatrics was able to put together something that was actually really helpful there. I think what causes picky eaters is really giving kids processed food and junk foods at a young age. What do we do when the child is 1 year of age? We give them a birthday cake, and they pile into that and get this incredible sugar and butter and all the things that we weren't really meant to eat right away at age 1. And I just don't, we all do it. I did it. We all do it. But I think it's sort of hijacking what their normal biology is all about. Their biology says that, I'm eating this, I've learned to eat this kind of food that slowly is absorbed and digested and absorbed in our bodies. and then suddenly I've got this kind of junk food that just lights up my brain, and that is the dopamine receptors in the brain. When they get a sudden surge of sugar, of energy, our brains are meant to light up like, hey, there's a good source of food that came from millions of years ago when we had to have a system that told our brains that, hey, pay attention to this area that has really good food source, like whatever it is. But if it was let's say you ran into some beehive that had honey or something, and suddenly you had all this energy. And yeah, it might be the healthiest of foods, but who cares when you're on the savannah and you're starving? It's going to mean that you and your family live if you find something like that. But in this situation where we've got kids that are learning to eat normal kind of foods, but then are being hijacked by feeding them this processed food, junk foods, that kind of stuff, it's just the wrong thing. What it does is it sets your expectations. Your brain expects, suddenly it knows that there's a higher level of stimulation that you could achieve, that you could be happy with. So why accept the foods that are being given you that are regular plants when you could have junk food? You can cry and all you want to try to get your family to give you the same kind of stimulating junk foods. And so that's what I'm talking about. If we can somehow not sneak our kids the junk foods at such an early age, and hopefully not hardly at all. But yeah, I think that's what we see is that we get these unprocessed junk foods. And I liken this to, in our Friday class, I started thinking about how it's kind of like cocaine. When you think about drugs like cocaine, it's basically stimulating your brain so intensely. Your dopamine receptors are finding a new level that they never have experienced. That, in a sense, you're like instantly addicted, because you will never not know about this way to stimulate your brain again. You're not truly addicted, but you have suddenly raised the bar to how much your brain can be stimulated. It in a sense, it's kind of like you're already addicted, even if you've just done this once. Your brain just suddenly, it's like, oh my gosh, I don't. This pleasure of living is not nearly as pleasurable as it was when I was high on cocaine. So there's an analogy there. It's not the same exact thing, but it's what I'm kind of coming up with in my mind, that when you're eating foods, you're kind of raising the bar to what new levels of pleasure you can have with eating. So the other thing I wanted to mention was sugary drinks, and how that does exactly the same thing. when we eat like a whole grain or something, it has to go through quite a prolonged kind of digestion process, not just in your stomach. It has to go through your small intestine, not just to the beginning parts of the small intestine, but the big parts of the small intestine. And it really takes a while for that to absorb and that energy to get into our body and to stimulate your brain. But with juices, I mean, that juice goes straight into your intestine and is immediately absorbed and floods your body with this energy that is not good, because then your pancreas, which pumps out the insulin, and that is trying to store all this energy. It's freaking out because it's got to deal with all this sudden energy from juice or soda. And so whether it's juice or soda, I don't think is a huge difference. People think of juice as being so much healthier. I think it's the same process. Yeah, the corn syrups are not good, but I just am not getting the same kind of feeling that that juices are any better. So really, I'm encouraging my patients, really, even above the age of 1 or 2, to try to not do juice so much. And certainly now milk. So I mean, milk's it's the same thing. It's calories. It's great for the mom's breast milk is great for kids, but it's absorbed much quicker. It's when you talk about a cow milk, though, it's not healthy. It's unnatural. Actually, there's studies that say that it can weaken bones, even though it's got a lot of calcium. The other thing I was thinking about was this idea that basically you've developed a kid that has unhealthy habits that basically are teaching the parents how to give them the wrong kind of foods, and parents are falling into this trap of, oh gosh, I just want my kid to starve, so I've got to feed him something. He's not eating the food I'm giving him, so I'm going to give him the junk food. And they go through a lifelong period of eating unhealthy, and this is exactly how the standard American diet gets imprinted in a child, in a person, and they just develop this incredibly unhealthy habit. It's kind of like then it's passed down to the next generation because they're afraid of eating real healthy foods either, and so it's the next generation. The children have the same problem, even worse maybe. So, yeah. Any other questions or thoughts? Did you guys all raise your kids perfectly, or did you do as I did, which was mess it up?
There's one more question by Beth. It says, unfortunately, there are a good number of parents who start feeding their babies solid food at early 5 months of age instead of waiting until 6 months. What are your thoughts on that? You mentioned the iron. You sometimes may feed them earlier. How about other foods?
Yeah, no, I really, it's ideal to wait till 6 months, and so you want to try to wait till 6 months, but I guess the problem is the iron, that I just don't think you're going to get enough iron through plants at sort of that time between 4 and 6 months. It's probably a really good idea to do just really not other purees, but actually just the infant cereals, just for that extra iron. So no, I don't think you should do other foods. If you're feeding formula, it's different. I think if you're feeding formula, then yeah, you start at 4 months, start feeding a variety of different foods. Yeah, including cereals at 4 months and other purees and other actually, you don't want to do baby-led weaning, where they're holding and feeding themselves until 6 months of age. So it's all purees until 6 months of age if they're formula feeding.
Can I ask another couple of questions?
Yeah.
Well, because I work with infants and toddlers. And anyways, and I breastfed my babies until they were like 2 or yeah. Anyways, because I feel very strongly about it. But don't breastfed babies get enough iron if they don't start eating solid food until 6 months?
No, there have been studies that really between 4 to 6 months, their stores are really starting to deplete, and breast milk just doesn't cut it as their bodies are getting better, as their stores have depleted. So it's really a strange time, this 4 to 6 month time. And yeah, I suggest doing some iron fortified cereals, but I just because there's the risk of losing IQ points. I think that's just huge. So I think
yeah, I did feed my kids solid food at 6 months, in addition, to breastfeeding. But okay, I didn't know that about the iron, but and then
so I should say that the breast milk, the iron in breast milk is very small amounts, but it's very well absorbed. So its availability, it's called bioavailability, is very good, which means it's well absorbed. The body can use it very easily. So that's good. But there's just not very much of it. And that's the real problem, is that, where are you getting the iron from? You're getting it from beans and greens, and that's really the main sources. But it may not be quite enough. So you might want to think about doing some infant cereals.
Right. You could even mix that with breast milk or something.
Yeah, exactly. That's what I like doing with breast milk. Yeah.
And then the baby-led weaning you talked about?
Yeah.
Do you mean like weaning away from breastfeeding, or just starting to have solids? Because I almost don't like that name, in the sense that, like babies really could breastfeed until they're 2 for the optimal health, but it almost sounds like they would stop breastfeeding at 6 months, but like a year is what people are encouraged to do.
No, I don't like that name, baby-led weaning, either. It's just the name that's given. If you look it up, go ahead and check it out. I should have got the video going on it, but I usually show a video about it. But basically, it's a process of babies learning how to feed themselves at 6 months of age. If they're sitting up well, if they're interested in food, if they are making lip motion, smacking motions, there's a bunch of things you can kind of look at to tell if a baby's ready to eat.
Right.
But this was first done in really England, and so we've and that was probably over the past 20 years or so, and we've gotten really big on it. You'll see it in the US. There's a lot of people that are doing it over the past 5 to 10 years. So 5 years. Yeah.
All right,
So
thank you.
Yeah. Check it out. There's some really good videos on baby-led weaning. But it's not weaning in the sense that you think of when you think of the word weaning. So you're right. It's a terrible word, but it's just the word that they have. I don't know if there's some other kind of word out there that.
Right, because you can have solid foods and breastfeed, obviously at the same time.
Yeah, absolutely.
Yeah.
And I do recommend people, if they can breastfeed to 2 years of age, that's great, or even longer if they can.
Yeah, I think my kids were actually both 3. But people like don't understand how that can be. They think it's, they're too old or whatever. But I mean, at that point, they're only doing that once at night. You know what I mean?
Yeah. Oh, yeah. No, I've got.
But my kids never had ear infections or anything. Like, they were just always healthy. So
I love it. I think it's just great.
Yeah.
Good for you. We're seriously good for you, because that's not an easy thing to breastfeed for 3 years. Times 2. Yeah, that's a lot of breastfeeding. Yeah.
Well, they're grown up now and doing well.
Oh, good. How old are they?
20, 25 and 22. No, 20. It's funny. I can't remember. No,
yeah,
24 and 20.
That's basically the age of my kids too. Great. All right. Any other?
So there's a question, are there things a breastfeeding mother can eat to increase the iron available to breastfed babies? And I just did a search. It says legumes, beans, peas, lentils, dark leafy greens like kale, spinach, cruciferous veggies, broccoli, Brussels sprouts, nuts and seeds. I don't know that you're doing a lot of that. Dried fruits like dates and raisins and apricots, and enriched cereals and grain products. So whether there's enough iron that a breastfeeding mother can accumulate, that's the issue, and probably safer to supplement with a little iron vitamin, whatever it is, preparation, or do you think it's just enough to eat iron fortified cereal?
I like the idea of prenatal vitamin continued through breastfeeding. So that's going to get you your extra iron right there. Yeah, I think I do want to say that mainly you're going to be getting your iron from those healthy foods. So that should be enough. Is it going to be enough to really make more iron in your breast milk? I don't think that's necessarily the thing. I think the issue is that when a mother is anemic, that the iron is preferentially going to the breast milk, and the mother is really getting more and more anemic and weaker. But I don't think there's a wonderful way of making your breast milk loaded with iron more. So, good question.
We're down to 5 minutes. Do you want to play
Yeah.
the last video on McGovern?
I like the successful one, but it's kind of long.
Okay. Which one?
The successful government dietary regulations.
Okay.
I was thinking about the fact that you can change so many eating habits by and really the health of your nation by making some simple regulations. But you watch
All right.
this video.
Why don't we play it then?
Okay.
All right, here we go.
The public health community appears to have all but given up on eliminating obesity. The latest World Health Organization goals include a 2025 obesity target of just trying to shoot for no further increase. Even such a modest-sounding low bar may represent one of the greatest challenges facing global health, one in which we are failing. Though there has been isolated pockets of patchy progress, no country has yet reversed the epidemic. Blame has been laid at the feet of the food industry lobby. The promotion of the overconsumption of high-calorie, low-nutrient foods and beverages has been identified as the major driver of the obesity pandemic. Now that we have rid much of the world of pestilence and famine, some public health proponents have gone as far as to suggest that the new vectors of disease are taking the form of transnational food corporations that market salt, fat, sugar, and calories in unprecedented quantities. It's considered the world's biggest industry. The processed food makers may alone bring in trillions. Put simply, concluded a senior director at a global health institute, the enormous commercial success enjoyed by the food industry is now causing what promises to be one of the greatest public health disasters of our time. But it's not their fault. Corporations just do what they're set up to do. Their goal is not to make people fat, just to make people money. The food industry manipulates ingredients such as salt, sugar, and fat, and spikes in caffeine and flavor-enhancing chemicals for reasons no more nefarious than maximizing profits. is just to exploit our natural biological vulnerabilities. Markets often incentivize companies to cater to and take advantage of human weaknesses. The food and beverage CEOs are not out doing victory laps in children's hospital halls to revel in their handiwork. They may simply have a fiduciary responsibility to maximize quarterly profits for their shareholders. It's just how the system works. But why do the corporations sell Apple Jacks instead of apples, or Orange Crush instead of oranges? To quote from the apocryphal Slick Willie Sutton answer on why he robbed banks, that's where the money is. The reason some of the unhealthiest foods are marketed is one of simple economics. Real food goes bad. Fruits and vegetables are perishable. What shareholders want is a snack cake that lasts for weeks on the shelves. Real food doesn't have brand names. Why would even a broccoli grower put an ad on TV for broccoli when you'd likely just buy their competitor's broccoli? The system is just not set up to reward the sale of health-promoting food. What kind of profit margins can you get on a sweet potato? Real food costs money to grow. Shareholders don't want dirt. They want dirt-cheap commodities discounted by taxpayer subsidies they can mix with carbonated water and sell for a few bucks a bottle. Dollar menu burgers are thanks in part to hundreds of billions of dollars of federal subsidies for cheap feed. Those who resist calls for heavy-handed government regulation may not realize those heavy hands are already pressing down the scale on the side of big business. Even without regulations, the market can be rapidly responsive, but only within certain parameters. The gluten-free craze is a great example. How many people had even heard of the word 10 years ago, and now some surveys suggest as much as 30% of the population is trying to avoid it. This has led to a 10,000-plus explosion in products labeled gluten-free, including from major players such as Tyson Foods launching gluten-free bacon and lunch meat. Ironically, gluten-free products may be less healthy, with more sugar and salt, less fiber, but are mostly just different shades of the same processed junk. A gluten-free donut is still a donut. A nutritional analysis of foods marketed to children found that about 90% of products, both gluten-free and not, were classified as unhealthy. That's the limit of the market. The invisible hand is more than happy to hand us any kind of junk we want, low-fat junk, low-carb junk, non-GMO organic junk, and especially ironic processed paleo junk. They can make money off of any fad except food. Shareholders can profit off any kind of Funyuns, but can't do much with real onions. Within a narrow scope of commodity components and chemicals, endless reformulations can fit any fashionable flavor of the month, but produce will never be as profitable. The market even prevents food manufacturers from taking small steps to make their products less detrimental, such as lowering salt or sugar content. Any deviation from the levels perfectly engineered for maximum craveability will get you immediately undercut by your competitors. How, then, was England able to so successfully lower sodium intakes, associated with a dramatic drop in stroke and heart disease deaths? Because they did it across the board. McDonald's Chicken McNuggets have 2.5 times more salt in the U.S. than the U.K., but that's because Burger King was cutting down too. In the best documented population-level sodium reduction to date, the British government formed public-private partnerships with major food manufacturers, retailers, and restaurant chains to simultaneously reduce sodium levels so slowly over the years no one would notice. The secret sauce may have been the level playing field, so no company could gain a commercial advantage by outsalting competitors. Analogous proposals have called for the stepwise, gradual, unobtrusive reduction in sugar in soft drinks to effect a similar shift in taste preferences on a population-wide scale. If this all sounds a bit big brothery, realize that people can still season and sweeten to their heart's desire, or rather detriment. You can salt your nuggets all you want, dump the whole shaker on, chug a bottle of corn syrup. It's all still your body, your choice. It's like the proposed cap on soft drink sizes. You can still drink all the soda you want. It's just trying to make the default options a little healthier. It's easier to add salt to food on your plate than it is to remove it. The life-saving success of the trans fat ban and society-wide sodium reduction may lie in the convenience of improving consumers' diets without them having to change their behaviors. Some view this as government overreach, but the slipperiest slope may be that of inaction. As the director of Yale Center for Food Policy and Obesity has pointed out, governments initially defaulted to business interests in the case of tobacco, to try to counter all the industry lies with weak and ineffective attempts at consumer education, and look what happened. The unnecessary deaths could be counted in the millions. The U.S. can ill afford to repeat this mistake with diet. Until the political will is summoned to make industry-wide changes in our food supply, we need to take personal responsibility for our own health, for our family's health, because it may be a matter of life and death. So what does that personal solution look like in the interim? That's exactly why I wrote How Not to Diet. Check it out at your local public library.
Okay. Well, we've definitely gone past our time. Any other thoughts or questions? If not, I really appreciate everyone being here, and I think we'll see you next. What's the Fridays?
Yeah, Friday's food label reading, and then here next Tuesday, also repeating food label reading.
Nice.
I'll be doing that. Yeah.
Thank you so much, Dr. Colgrove. That was fun session, lots of good videos. And if anybody has a question, you might send it in. I suspect you could send it into the website and maybe get a response back.
Thank you.
Yeah.
That was very helpful.
All right. You're welcome. Thank you. Thanks for coming. All right.
Thanks again, Eric.
Thanks. Yeah, thank you, Eric.